Thank you for coming today. I would just like to have an initial welcome to all of you who are braving this beautiful weather to come here. We are engaged in the discussion of health care reform. I'm joined with my partners in crime, Senator Reagan, Senator McCoy, who are hosting this event, and we also joined with Senator Bolcom, and we'll have our colleagues from the House and Senate come in throughout the day. We'll announce their arrival so you know who's here. My job today, and all our job, is to just listen. This is not to be a debate. We are just going to listen to what you have to say, the stakeholders, on how we are to implement health care reform in this state. And I would just first like to extend my gratitude to the Iowa Hospital Association and to the Iowa Health Systems for initiating this idea and then also allowing us to use your facility. This is the kind of community outreach that is going to be important for all of us. I hope that not only will we listen, but that you will too, and that ideas that will be generated by individual stakeholders and groups of people will maybe kindle an idea that you hadn't thought of or reinforce something you think is good. In any event, we're here to start the dialogue and the discussion in the Iowa legislature. And now I would like to introduce and have you hear a few comments from my colleague, Senator Amanda Reagan.
Thank you, Jack. It is a pleasure to have all of you here today because we all know that there are many opportunities and many challenges for Iowa with their health care access, and so this will be a great day to share. We are going to try to keep everything flowing, and we will have a timekeeper, but be sure that you feel free to come up here and share with us because this is truly about listening. We will announce, as Jack said, to have senators and House members that come in during the day. It's a pretty lengthy period, but as you see, we have a lot of guests here to talk about this. We also are going to have this videotaped, and so Rusty Martin here from our staff is going to put this on Iowa Senate Democrats' website, so be sure to check it out afterwards if you feel that you're not able to stay for the whole event. But we're here to make sure that we can get your comments and want to make sure that we are able to assess all of this, and this is a great opportunity for all of us. We also have Senator McCoy here today, and he will be able to give you a little feeling of why we have him involved, especially with the Commerce Committee, and as chair, he has been very involved in this issue.
Well, thank you, Senator Reagan. It's a pleasure to be here today, and on behalf of the Senate Democrats and the members of the Commerce Committee, we want you to know that we take this issue very seriously. We want to be listening today and gathering your ideas for how we should move forward in the next session. Last session, we worked very hard in trying to prepare and implement for the Affordable Care Act. Unfortunately, decisions were made that did not allow this to happen as it relates to a statewide health exchange. And so now I think that the Senate has demonstrated the leadership in getting this done. It will be important for us to have a game plan as we move into the next session and prepare for what will be known as either a hybrid exchange or a national exchange or some type of state exchange. But I think, again, this is a great opportunity for us to communicate in one voice very clearly what our concerns are and focus on how we expand and how we move forward to get uninsured and underinsured the coverage they need and how we do this within our existing system. I think it's very important that we move forward and do it in a cooperative way as opposed to spending our time fighting about whether this is going to happen or not going to happen. Clearly, this is going to happen, and we want to be a part of it, and all of you are in the room today because you want to be a part of it, and that's what we need to do moving forward. So, again, thank you, Iowa Health Systems, and thank you, Iowa Hospital Association, for hosting this event. Thank you, staff, for putting this event together, and we look forward to hearing from you today.
I feel like I have the Academy Award envelopes. I have the list of speakers here. What I will do is call up the speaker and then announce the person who's up next or on deck, as they do in situation. And we'll ask you for 3 minutes. Rusty Martin is the hook. He'll be sitting here. We're not going to tear it away from you. We want you to make sure you have a thorough, as much as you can, provide us with your ideas and your thoughts. Before I ask the first person to come up, I just want to acknowledge our State Representative-elect, Marty Anderson, has joined us at the table. Thank you, Marty. And the first speaker is Dr. Richard Deming from the American Cancer Society. And then on deck is Clare Kelly from the Iowa Medical Society.
Thank you, Senators. It's an honor to be here. I'm Dick Deming. I'm Medical Director of Mercy Cancer Center, and I'm speaking on behalf of the American Cancer Society Cancer Action Network. We refer to it as ACS-CAN. It's the advocacy arm of the American Cancer Society. ACS-CAN is committed to ensuring that everyone has access to quality, affordable health care. Today, too many people are uninsured or have insurance that's inadequate, leaving them to face difficult financial circumstances and even bankruptcy after a cancer diagnosis. Lack of adequate health care insurance has serious consequences for those facing cancer. It can mean treatment is delayed and costs are increased because later stage cancers are associated with more complex and more expensive treatments. The uninsured are more likely to be diagnosed with a late stage cancer and are less likely to survive the disease. We have a wonderful safety net that catches people, but the safety net catches people with cancer, with advanced cancer. Safety nets don't pay for prevention and screening and early detection. The Affordable Care Act contains many provisions that significantly improve the health care system for cancer patients and their survivors. ACS-CAN is working to ensure that the Affordable Care Act is implemented as strongly as possible for people with cancer. Two of the ACS-CAN's health care priorities include ensuring that the Iowa Health Exchange is set up in a way that works for cancer patients, survivors, and their families, and secondly, expanding Medicaid to serve more working families in Iowa. First of all, Medicaid. Medicaid plays a vital part in our health care system, covering many of the nation's poorest and sickest patients and providing a critical financing mechanism for health care services these individuals receive, including cancer-related services. ACS-CAN has long supported efforts to keep state Medicaid programs strong because of their importance in providing the access to care necessary to fight cancer. A recent report from ACS-CAN and Families USA found that Medicaid provides vitally important health care services for over 8,000 Iowans with cancer. For them, Medicaid coverage is critical, and many could not afford the care they need without it. Medicaid helps make it possible for cancer patients to see a doctor when they need it, fill prescriptions and keep up with screenings, get the care they need if illness recurs. Medicaid enrollees are more likely than the uninsured to have a usual place of care and to receive the recommended preventive screenings. There's evidence that patients who enrolled in Medicaid prior to their diagnosis have better survival than those who enrolled after their diagnosis. In terms of the healthcare exchange, ACS understands the implementation of healthcare exchanges will be critical to the success of the Affordable Care Act and serve as a gateway for millions of people to access coverage. In order for cancer patients and their families to experience real changes in their ability to access, choose, and purchase comprehensive health insurance, policymakers must tackle critical challenges. To that end, ACS has a series of questions that we'd like the legislature to ask themselves as they move forward with setting up this exchange. These questions include considerations that will be important for serving cancer patients. Number one, a strong governance structure that includes consumer representation. Number two, integration with Medicaid, and ease of transition in and out of the exchanges. Number 3, administrative simplicity, which allows consumers to easily compare and purchase the health plan that is right for them. And lastly, stable funding. American Cancer Society CAN supports improvements that will provide access to affordable health care for all patients with cancer. Thank you.
Thank you, Dr. Deming. Clare Kelly, and then Mary O'Brien from the Visiting Nurses.
Good morning. My name is Clare Kelly. I'm the Executive Vice President of the Iowa Medical Society. And on behalf of our more than 5,800 physician members, we'd like to thank Senators Reagan, McCoy, and Hatch for organizing today's event and for the opportunity to provide comments on the issues and opportunities facing Iowa's healthcare delivery system today. Looking towards the 2013 legislative session, the Medical Society's top priorities revolve around ensuring that Iowans have access to high-quality healthcare and that our physicians have the resources necessary to continue to provide that care. This is why the Medical Society will be advocating for the state to take advantage of the opportunity under the Affordable Care Act to expand Medicaid eligibility to those Iowans making less than 138% of the federal poverty level. A recent report conducted by the Urban Institute on behalf of the Kaiser Family Foundation estimated that Medicaid expansion would actually save the state $546 million in healthcare costs over the next decade by reducing the cost of uncompensated care and transitioning individuals who currently receive a limited healthcare coverage under the Iowa Care program to coverage under the expansion at a higher federal funding rate. Medicaid expansion could ensure that these individuals have access to more comprehensive medical care from a provider in their local community. However, we understand very greatly that coverage alone does not translate into access to care. That's why the Medical Society will also be advocating for systematic improvements in our Medicaid program, starting with action to address the program's woefully inadequate reimbursement rates. Over the past decade, practice expenses have grown by more than 20%, while Medicaid rates have remained nearly stagnant. Congress acknowledged that low reimbursement rates would serve as an access barrier when it incorporated into the Affordable Care Act a 2-year targeted Medicaid rate increase for primary care physicians. Unfortunately, this increase was arbitrarily applied to only select physician specialties. We know that primary medical care is not provided by just a handful of specialties. So we believe that the state should follow Congress's lead in targeting reimbursement rate increases to the most highly utilized services, but not restrict the specialties to which this increase applies. By reinvesting a portion of the Medicaid expansion savings in this manner, the state can amplify the impact of its investment, and Iowa physicians will be better equipped to continue providing high-quality care. We will also be advocating that the state build upon last session's progress in addressing Iowa's physician workforce shortage. The Association of American Medical Colleges estimates that within the next decade, our nation will face a physician shortage of over 90,000 doctors. Iowa is currently ranked near or at the bottom nationally for a number of physicians per capita in a number of specialty areas, and without action, these rankings are likely to worsen. So we believe that the state should reinvest a portion of the Medicaid expansion saving to support the Rural Iowa Primary Care Loan Repayment Program, which was established earlier this year. So this joint public-private partnership will serve to recruit more primary care physicians to practice in Iowa's rural areas and improve access to medical care. Thank you again for this opportunity. We look forward to a productive legislative session, and we stand ready to offer a clinical perspective to the healthcare policy debates of the coming year. Thank you again.
Thank you, Clare, and welcome to Iowa.
Thank you.
Clare is the new Vice President of Government Affairs for the Medical Society, and we'll see a lot of her.
Very good.
Mary O'Brien, Visiting Nurses, is up, and Dr. Engelbretson from Primary Care is on deck. Hey, Mary.
Good morning. My name is Mary O'Brien, and I'm representing today Visiting Nurse Services of Iowa and also HCI Care Services, which was formerly known as Hospice of Central Iowa. First of all, thank you, Senator Reagan, McCoy, and Hatch for hosting this event today. It is a very valuable opportunity for healthcare providers and stakeholders to provide input regarding healthcare reform in Iowa. Visiting Nurse Services of Iowa and HCI Care Services both view healthcare reform through a two-dimensional lens: how it will impact, first, the clients we serve. Second, how it will impact our ability to provide those quality services. We do much of our work partnering with other coalition and advocate groups. We also, though, pursue our own agency's priorities. With that in mind, our health care focus this session will be on, number one, Medicaid expansion. It is a last line of defense for those that we see and who cannot afford coverage elsewhere or who have exhausted savings to pay for a physical illness. Additionally, Medicaid expansion allows for the coverage of mental health and substance abuse benefits, a critical component of needed health services in the communities. We will work with other community partners on this particular initiative. The Health Insurance Exchange. It is vital that the exchange is designed to meet the unique needs of varied population groups. Language, literacy, comprehension, and seamless eligibility are important considerations. We will work on this through the Iowa Healthcare Advocates Coalition. Expansion of the first 5 programs statewide. VNS of Iowa was a proud original site of this program. It is a nationally recognized program that is a partnership between maternal child health agencies and primary care providers. The goal is to foster the child's healthy mental development. Surveillance identifies those developmental delays in children 0 to 3. And they also provide the care coordination for referrals. We would like to see that expanded statewide. The last priority on this relates to the hospice, the HCI Care Services side, and that is asking you please to use your influence and support federal efforts for a rural add-on for hospice in Medicare and Medicaid. HCI Care Services provides mission-driven hospice care to all patients regardless of their ability to pay. The majority of the hospice care is provided in the home setting, where Iowas claim they want to be. And the rural add-on is for transportation costs, which are incurred by those mission-driven agencies. In conclusion, please make sure that healthcare reform reflects the unique needs of the uninsured and vulnerable populations. Thank you.